Chang Moh, as the COVID-19 pandemic seems to be coming to an end and the business have started. Many of them, in fact, are reinventing themselves, writing their story on the world. I am one of the earliest urologists in Malaysia, can be considered probably the most senior full-time urologist in Sarawak. So I thought I will put down in a video form of what I have been up to for the last 41 years as a medical doctor. I have been very much inspired by these two gentlemen, Professor Christopher Chan, who passed the exam together with me in Glasgow in 1986. He went on to become the head of urology department in Singapore General Hospital, and recently he wrote a book about himself as a cancer prostate patient. And before I went for my exam in 1986, I attended Professor Foo Kyung Tak's lectures on urology, and I continue to learn a lot about urology and philosophy in life from these two fine gentlemen. This is the earliest photograph that I can find on myself. I am fourth on the right, in the front row from the right, and I'm sitting next to my mother, and I believe she's holding my next brother, Chong Wong, and that's my sister, Lily. And this is now in December during my birthday with my second son and my wife. And I have been renting a clinic space in the Norma Medical Specialist Center, which belongs to the state government, since 1996. My parents came from China as a little boy, and they originated from the Guangzhou province in a town called Xinhui, which is about 1 hour by boat from Hong Kong. And I went there in 2015 with my wife and my daughter. And this is the brick house that my parents and grandparents stay in. The house is still standing, although it's unoccupied. And this is the address in Chinese. We visited my mother's younger brother, this is my daughter, in his house. And he just passed away on the 30th December 2022 during the latest pandemic, COVID-19 in China. I am born in the town of Serike, which is at the bank of the mighty Lei Chang River. It's called the Pineapple Town. And when I was born in 1956, Sarawak was still a colony of the British Empire. These are my parents. My father passed away in 2009 at the age of 87. He was a heavy smoker. My mother passed away in 1986 at the age of 61 from nasopharyngeal carcinoma. And this is our first house, an atap house with my parents. I'm here sitting on the top with my younger brother, Chong Wong, younger brother, Chong Lei, and my youngest brother, Chong Weng. And these are the two sons of my cousin. This is the house. Later on, we moved to a wooden house, which is at the promontory of two rivers, which is supposed to give very good feng shui. And this is the house later we got it painted. And these are my colleagues who visited me. Visited my old house in 2011 when the health carnival. This is Dr. Kotzaway, Dr. Pravin, and Dr. Roger. And this is the rest of my siblings. The eldest, my sister, who is a seamstress, still alive in Miri. My eldest brother, agriculture officer. The second brother, who is a retired government teacher. My sister, also retired government teacher. And this is the next brother, Chong Wong and Chong Lei, who are both mechanical engineers, both retired. And the youngest brother is orthodontic working in Kuala Lumpur. So this is my family. Nobody is staying in the old house now. My schools, my first school is the St. Anthony's Primary School, which I don't have a picture of, and this is the St. Anthony's Secondary School. I studied there from 1969 to 1971. It was a very old school. Now it looks different. I was then kicked out and sent to a school near my home, Serike High School, 1972 to 73. And later on, I came to Kuching to study in the oldest school in Sarawak, which was started by a priest doctor in 1848, the St. Thomas' School. And this is the boarding school of St. Thomas, where I stayed in 1974 to 75. Among my benefactors, of course, my parents, my brothers, my sisters, and in particular, my teacher, Mr. Y. John. The late Mr. Y. John, who helped me to get a scholarship by speaking to the late Dato' Abang Yusuf Puteh, who was the chairman of the Yayasan Sarawak. And this is during our regular Hari Raya visits with my wife, my son, and my mother-in-law to the late Dato' Yusuf Puteh. So I got a scholarship from Yayasan Sarawak to study at the University of Malaya, 1976 to 1981. The allowance was only 3,000 ringgit per year, but that was enough to pay my school fees the boarding house. This is the boarding house that I stayed in, and this we had 128 classmates. We're divided into groups. This was one such group, and many of them become very prominent doctors and leaders. This is Professor Nohati Osman, who is Professor Emeritus of Pathology in USM. My housemanship was done at the Sarawak General Hospital before it was repainted like this. And now, of course, it has undergone further renovation. I was a houseman there from 1981 to 82, before being sent to work in Kapit Hospital, 1983-84. There was me with my colleagues, Dr. Kumar, Dr. Hanifa, and the medical students who came and visited us. We had to help run the Riverine Dispensary as well as the Flying Doctor Service. And once the Flying Doctor Service was landed, we were stuck in the long jungle for 2 nights, and we even had to cook a snake that came into our compound. I did my postgraduate urology in London, firstly in London at the University College London, including some time at the Great Ormond Street Hospital for Children, and I stayed at a nearby London House, which is a postgraduate house for postgraduate students for Commonwealth countries. And I next spent 14 months under the government scholarship to Edinburgh University, where I studied at the University of Edinburgh Western General Hospital under the late Professor Chisholm. I also worked at the Nuffield Transplant Surgical Unit for 14 months. The sponsorship was only about £200 per month, but with my salary running, I was able to bring my wife and my first son, Paul, to do our postgraduate urology in the UK. Of course, as a medical specialist, I need to sit for all kinds of exams. This is my first exam held in the Royal College of Physicians and Surgeons of Glasgow in 1986. Then I did the Intercollegiate Board, FRCS Urology, and also the Fellowship of European Board of Urology and the Diploma of Urology in London. And in recent years, I also did the Postgraduate Diploma of Medical Education from the University of Dundee. My involvement in urology is very closely linked with the Malaysian Urology Association. Since 1986, I was the president in 1998. The Malaysian urologists are one happy, united family. We know each other we almost know everybody in the association. And since 1998, we started the Malaysian Board of Urology to formalize our system of training and examining our urology trainees with the help of the Royal College of Surgeons of Glasgow. As a lecturer, we lectured in different parts of Malaysia, mainly on functional urology, on the prostate, on the bladder function, on erectile dysfunction. I lectured in Johor Bahru. Professor Nohati Osman invited me to lecture in USM to the pathologists. We lectured in Kota Kinabalu. And GHKL was my greatest passion, where I worked from 1984 to 1995, and I continue as an honorary consultant to the now called Hospital Kuala Lumpur, Sarawak General Hospital, and the Sarawak Heart Centers. My close colleagues, Dr. Rohan, who is the Chief of National Service of Urology, Dr. Teh Kwan Chow, who is the Chief of Urology in Sarawak, and the successive heads of urology in Hospital Kuala Lumpur, Dr. Malari Sundram, Dr. Susan Wu, and now Dr. Ashani. We know each other very well, and in fact, we know the family well as well. This is Dr. Ashani coming to Kuching, where we had the dinner together with my wife and my daughter. And in fact, there is a special collaboration with the government hospital, and we also require permission. In fact, it's quite a tedious process to require permission all the way up to the Director General of Health for us to have this public-private partnership. I was also involved in the kidney transplant program when I was in GHKL from 1990 to 1995. I think probably did about 100 of these transplants. And this is me with Dr. Kozue when he was in GHKL. We harvested kidney. and we put it into the recipient, usually the son. This is one mother to son donor pair, and this is another group of transplant surgeons who came from Kuala Lumpur. This is Dr. Lim Meng Shi, Dr. Kanda. We harvested from a deceased donor in Kuching Hospital, in the Kuching Hospital. I work very closely with the nephrologist. This is Tan Sri Abu Bakar Sulaiman, who was the head of nephrology when I was in GHKL. Later, with Dr. Zaki, we presented a paper together in Singapore in 1992. We continue to work together with the CAPD program. This was 1994, where they celebrated the 10th anniversary of CAPD program. And we work also closely with the pediatricians, the pediatric nephrologist, Dr. Lei Chang Moh, and later Dr. Yap Yok Shin, and this is Dr. Shelley Yap, who is working closely with us in Kuching. And from the year 2000 to 2014, I was closely involved with the pediatric renal transplantation program in Malaysia, although the numbers are very small. I have a special interest in urodynamics and uroflowmetries, and I always believe that urodynamics is very important. I believe in the uroflowmetry to check the bladder function, and I also helped Dr. Shahabuddin to set up the kidney transplant program in the private hospital in Kuala Lumpur, and this is the first robotic radical prostatectomy in SGH, a team which is led by Dr. Yong Haufi from Johor Bahru, Dr. Tay Kwan Chow, Dr. Lim Meng Shi, and of course, urology is a lot of teamwork with the anesthetists, with the nurses, with the OT technicians, and this is me helping the group, the National Kidney Foundation and the Bonus Link Group to set up the first NKF dialysis center in Serike. And I also involved in setting up of the Sarawak Heart Center, Kidney and Stone Center in Kota Samaran, Sarawak. The urologist, through the advanced urology courses, helps in the training of urologists since 1998, and I was particularly involved in the pediatric urology program. This is one such course, and this is another course where I invited my university classmate, Dr. Chia Vian, a pediatric surgeon, to help in the training of pediatric urologists. And we also have sessions in the theater. This is one such session where the senior urology nurse, the pediatric urologist, Dr. Roger, and the pediatric surgeon, Mr. Chung, we work together to put our heads together to give the best input to the patient. I also involved in teaching and mentoring students to pass the exams, and this one such lecture I gave early last year. Of course, it's done by the Zoom session. The Malaysian Urology Congresses have been on since I first started it with Dr. Peter in 1991, and I was much honored to be given the MUC, or the Malaysian Urology Congress Award, in 2016, and again in Kuching in 2017 by Dr. Kort Silwe and Dr. Tay Kwan Chow. And recently, this year, we work with the pediatric surgeons in KL, and also from the Great Ormond Street, invited through Dr. Roger to do run master classes for the pediatric urologist trainees. We spread urology to Sarawak and to Malaysia, usually through the local branch of the Malaysian Medical Association. This is in Sabah, this is in Cebu, through the local surgeon, Dr. Clement Chen, and through Dr. Sufian, and this is giving the lecture in USM in Kota Baru, and this is through the medical department of the Sabah Health Department. The Sarawak Urology Group are very united group as well, through the able leadership of Dr. Tay Kwan Chow. These are all the urologists which has come through Sarawak Urology, and this is the huge family of Sarawak Urology trainees, the paramedical, the consultants, the specialists, the registrars, and we have a update, Sarawak Urology update, or now they call it Borneo Urology update, every year, and we work closely with the nurses as well in the dialysis unit. So we do a lot of the vascular access together with the vascular surgeons as well. I've been asked to join the College of Surgeons by Dato' Mehta, and since 1997, I've been a fellow of the Academy College of Surgeons, and involved closely with the activities as the Sarawak representative. We used to organize the Kuching Forum until the pandemic, and we participate in the college activities, either in talks or in debates. And this is one such debate I took part, obviously enjoyed much enjoyed by the audience. And when the Royal College from Edinburgh come for exams, we often organize get together with them. We spread urology through Borneo. We talk in Pontianak. We give lectures in Brunei, either in person or through the Zoom session. We go to Sabah, and even we have the meeting in Kuching locally. Now, yeah, there are hybrid sessions. We can Zoom into the rest of, usually the rest of Malaysia, and sometimes to Singapore as well. This is the ASEAN residence course in Singapore, where I was invited to be a faculty, and we talk. Many of them are nowadays are hybrid sessions, and of course, I also join a lot of their sessions as well through the hybrid modality. The Malaysian Urology Association is an active supporter of the ASEAN Urology, called the Federation of ASEAN Urology Associations. I have an interest in transrectal ultrasound, and this is one such course that we organized, a hands-on course in Penang in 1999, and we have meetings with the urologists in Indonesia, urologists in Vietnam with the then President Dato Salva. We have debates, we take part in debates with the Thais, and we also will go to Myanmar, and this is in southern Thailand. And since 2016, through the offices of Professor K.T. Fu when he was Executive Director of UAA, and Dr. Teh Kuan Chow when he was President of the Malaysian Urology Association, we started the session of the FAUA at each EUA annual congress since then, and now it's taken over by Dr. Ashani. I've also been an active member of the Urology Association of Asia, accumulating in the award of the honorary membership to me in 2019. This is the highlight of my urological career. This is the award ceremony. Of course, it comes with some work. That is, I have to give a lecture, and I was also invited to give lectures in the Congress in 2015 when I talk about pediatric kidney transplantation, and I was invited especially by Professor Oh Yen Chuan to Taiwan in January 2020 to talk about the training of Malaysian urologists. I strongly believe in postgraduate urology sharing and learning, and in fact, we presented our system to the Director General of Health in 2016, and in 2017, the President of the Malaysian Urology Association, Dato Salva, led a group where we have a one-day workshop to revamp our entire curriculum. And since then, we have more sessions where we have case-based discussions. This one such session that I share almost every Tuesday morning from 8 to 9 with my fellow urologists to the trainees at the Sarawak Heart Center. As far as publications is concerned, now it is a requirement for all the Malaysian trainees to have a publication in a peer-reviewed journal before they can sit for the exam. I only had 31 such publications, although I have many meeting abstracts, videos, either as independent videos or in the YouTube, although I gave a lot of lectures to professionals. I was seconded through the offices of the then Minister of Education, the late Dato Sulaiman Daud, to be a lecturer at the local university in 1995. And in those days, we only have the product cabins to teach. I was seconded on a salary of about 5,000 per month, and then we had started a new curriculum where, as a urologist, I actually taught the renal block, but we only had, at that time, we only had about 30 students. Now the class have expanded to 140 students, but the rooms that we have are still very limited, and often when I go to teach in Sarawak General Hospital, we have to use the open space to teach. And I'm very proud that there are 5 urologists in Malaysia now who are previously students of UNIMAS, and I continue to be involved in UNIMAS as an exam lecturer and then as an exam professor. Now, during the COVID, we learned new modalities of continuing our teaching and learning through the Zoom forum, and even when we go to the ward, we limit the numbers to 5 students, and we, of course, we wear protective gear such that we do not encourage the spread of the COVID-19. My other important role is as an examiner. I have been an examiner for undergraduates, postgraduate urology, the MRCS and FRCS since the year 2000. And this is the first exam in the year 2000 with Professor Mandi and Dr. Professor Shahabuddin, the first urology exit exam in Malaysia in the year 2000. Later on in the year 2008, we have the exam conducted by the Royal College of Physicians and Surgeons of Glasgow, led by Dr. Graham Conn, my colleague when I was in the Western General Hospital. My work, my urology work, is still based mostly at the normal urology clinic. Since 1996, we have a stone center, we have a theater, we have a team of theater nurses. We have a surgical radiology meeting every Wednesday from 1 to 2, which I chair. And every Sunday, well, almost every Sunday, I have my outstation clinics where I continue to see patients which I've been seeing for 20 to 40 years. Not only the patients, the surgeons like Dr. Clement Chen and many other surgeons who work together with me over the years. I'm very grateful to them. So I continue to work on Sundays, 3 Sundays a month. Well, you may ask, what are my hobbies? My hobbies are gardening, in my house, outside my house, and I have 3 dogs right now. We go for walks with my family almost every day, and when the weather permits, when we have time, I go pond fishing, river fishing with my daughter and with my son, and we do some gardening as well in the land that we have, in the ancestral land that we have in Serike. And of course, we try to swim every day. We have family meals together, and whenever we have a chance, we go for family nature outings. This is one such outing at the Survivor Island off the coast of Sabah. I have a few service awards. The first one is from the Sarawak General Hospital in 1984. Next one is from the General Hospital in Kuala Lumpur in 1987. And the recent award is from the Malaysian Urology Conference in 2017. Of course, family is very important. I was engaged and married to Ivy Chin Melin, who is a government school teacher for more than 30 years. She just retired 2 years ago. These are my 3 children. My eldest son, Paul Lei, is a GP in London. My second son is a medical doctor. He's doing his PhD in medical education at UNIMAS, the local university. And my daughter has passed her MRCP, hoping to do neurology. I followed my wife to the St. Thomas Church, and I was baptized in 2004. And we are a very close family. And this is my daughter sending Christmas roses to us, ordered from London. My mentors, there are important ones to mention. First is Dr. Sengupta, who was supervised my housemanship in 81, followed by the late Dr. Ranjit Uman, who helped me with my early surgical career in 1982. And when I went to KL in 1984, I was mentored by Dr. J.C. Mehta as well as Dr. M.K. Teo, who later became the MPS medical director. And I also traveled to Ipoh for many years to cover urology there under Dato Kandasamy. And when I was in urology full-time, 87 to 94 in GHKL, my mentor was the late Dato Dr. Carola. Here he's seen with the nephrologist, Dr. Teo Lim and Dr. Hui, who of course are also great mentors. And then I learned a lot from the nephrologists as well. I have feedback from the patients. Luckily, most of them are good. They thank me for my so-called medical talent, but also important that I'm happy that they know that the caring aspect is also important. And one aspect of my care is that I like to have good documentation. I often give them a medical report and I keep the records in order. So this is appreciated by the patient. I have many near misses to my life. I cycle and have a motorbike when I was a student, and of course, when it's raining, I have many near miss road traffic accidents. In 2010, I was requested by my hospital to give a talk with my colleague, Dr. Lung, to nearby Indonesian town of Pontianak. And this is where our taxi overturned after it knocked into a sectional lorry. And as recent as March last year, I tried to cycle to work, but on that day it was raining and I had a very busy clinic, and I haven't had my meal and I fainted on the road. But before I fainted, I set on my Google location, and my daughter in London picked it up, and she called up my wife and my other son to come and look for me, and that saved my life for that day. Briefly, my mission and the vision is to have up-to-date standards of urological medical practice. The most important thing is integrity, and if as much kindness, happiness, compassion, hope as possible. And of course, having a healthy living physically and mentally is important. Of course, there are many others we can discuss. So in summary, ladies and gentlemen, I am just a humble urologist, medical doctor, born to a poor family in Serike, Sarawak, 1956. My parents came from China. I studied in school in Sarawak. I did medical school at the University of Malaya in Kuala Lumpur. I did postgraduate surgery, urology in the UK. I passed exams in surgery, urology, medical education, and I continue working in urology, teaching, learning in Sarawak, Malaysia. I'm an examiner in undergraduate, MRCS, FRCS urology. I have humble service awards 84, 87, also from my hospital in 2003, as well as the Malaysian Urology Conference Awards in 2016 and 2017. The highlight was the conferment of an UAA, Urology Association Honorary Member Award in 7 August 2019. I aim to have utmost integrity, hard work, happiness, and taking care of health, physical and mental of myself and my family and all my patients, and I hope we can discuss more next time. Thank you very much for your attention. I hope you have enjoyed listening to this brief biography of myself.